Hello guys, welcome to Alicia's Med Hub. Today we'll be doing pharmacology and we'll be discussing drug formulation and routes of administration. Therapeutic drugs are formulated pharmaceutically to produce desired, therefore pharmacokinetics parameter characteristics, route of administration, and physiochemical properties of the active drug, which include solubility, stability, disintegration, as well as the solution profile. Drugs are presented in a wide variety of dosage forms. Now, the types of drug formulation include we have the solution, which the example is syrups and injectables. We have suspension, example is mist, magnesium trisilicate. We have emulsions, example is Sloan's liniment. Then we have tablets, we have capsules, we have powders, and we have granules. Now, this is an image of a bottle containing both tablets. These are tablets. These are capsules. These are injectables, which could be intravenous, intramuscular, intradermal, depending on the chemical nature of the drug. So these are topical. These are for topical applications, creams. Then we have capsules in these forms. So route of drug administration include we have the anterior route, we have the parenteral route, we have the topical route. Um, We are going to explain each of this in detail. Now, the entire route of drug administration, example, include the oral, sublingual, the buccal, and the rectal. The oral, that's through the mouth, sublingual, um, just below the tongue, then the buccal, by the side of the cheek, then the rectal, of course, through the anus. And oral, that's applying or swallowing. Oral dosage forms include tablets, capsules, liquid, solutions, suspension, syrups, elixirs. Advantages of oral route. It is convenient. Absorption takes place along the whole length of the GI, that's the gastrointestinal tract. Then it's cheap. Disadvantages of oral routes include it is sometimes inefficient, undergoes first pass effect, irritation to gastric mucosa, obstruction by gastric acid and digestive juice. It cannot be used in emergency situations. And the reason for this is because in emergency situation, for example, if the patient is hypoglycemic and you need to restore the sugar level, the blood glucose level, giving glucose orally is not really smart, right? Because you need to the cells are in need of glucose. So the best way and the fastest way to do is intravenously. So giving orally is not a smart way in emergency situations. Now, sometimes it could be unpleasant. It could have unpleasant taste. Um, some drugs have unpleasant taste, right? It cannot be employed in unconscious patients. Yeah. So sublingual route dosage forms is placed just under the tongue, like I said earlier. Sublingual route, the dosage form is placed just under the tongue. Now, advantage of sublingual route: it's economical. Drug absorption is quick. It circumvents first pass effect because it goes almost directly into the blood. So it circumvents first pass effect. Disadvantages of sublingual routes. Few drugs are absorbed via this route. There are few drugs that are administered via this route. It is not suitable for unpalatable drugs and drugs that irritate oral mucosa. It is not suitable for unpalatable drug because if the drug is bitter or sour, you feel it because it's just right under your tongue. Now, only small doses can be administered. Other route of drug administration: drug is placed drug is placed just beside the gum and the inner lining of the buccal pouch. Advantage of buccal route: first pass effect is avoided, right? Because it goes directly into the bloodstream. It is suitable for drugs that are degraded by gastric juice. It is suitable for drugs that are degraded by gastric juice. So if you an advantage of it is that there are certain drugs that when you administer orally, because they pass through the stomach, they will be disintegrated by the gastric juice. But if you administer that same drug through the buccal route, you have avoided that whole process. That's what it's saying. It is associated with rapid absorption, yeah, because it goes directly into the blood. Disadvantage of buccal routes: it is inconvenient in administration, restricted to only small doses. The advantage is lost if the drug is swallowed. Rectal route of drug administration: there are suppositories and enema. Advantages of rectal route: it is suitable for unconscious patients and in children. It is used in nauseous and vomiting patients. It is easy to terminate exposure to the drug. It is a good route of laxative. Laxatives are drugs that are used to enable one, pass to. It facilitates bowel movement. So it helps one to pass to effectively. Now, disadvantage of rectal route: it is inconvenient, absorption is slow and erratic, irritation to the rectal mucosa. Now, systemic route of drug administration: systemic or parenteral route. It includes injectables, which are IV, which is intravenous, IM, which is intramuscular, subcutaneous, intraarterial, intra-articular, that is within um, the articular cavity, intrathecal, intradermal. Inhalation: it also includes inhalation or systemic or parenteral route. Absorption is through the lungs. Intravenous routes. Advantages of intravenous routes: it ensures immediate pharmacological response. So this is the reason why it is it is more important or more advantageous in emergency situation, because its effect is immediate, right? It's immediate. Bioavailability is 100% because you are introducing the whole drug into the system. It's not passing through the stomach. It has the first pass effect has been avoided entirely. So suitable for large volumes of drugs. It is employed in emergency situation, diarrhea, vomiting, and vomiting patients. First pass effect is eliminated entirely, right? First pass effect only occurs when you are using the anterior route. Yeah. Problems of absorption as are convected because the entire quantity of the drug enters the vasculature directly. Yeah. The problems of absorption you know, are completely avoided. For example, if a patient has done intestinal resection, for instance, and a major chunk of the intestine has been removed, particularly the small intestine where absorption takes place. If you if you are administering an oral drug, right, the possibility of that drug not being completely absorbed is there. Yeah. So, intravenous, that's where intravenous route comes very handy. Now, gastric manipulation and GI irritations are avoided. Disadvantage of intravenous routes: in the event of overdose, the administered drug cannot be easily removed. That makes a lot of sense. If the advently, if inadvertently given, neither can the drug be removed nor its absorption retarded. Possibility of embolism is there, yeah, particularly embolism, particularly if an insoluble drug is given. Danger of infection, yes, because you are introducing the drug to the blood, and if that area you are, injecting the needle is not sterile, there's a possibility of you introducing um, infection into the systemic circulation. Subcutaneous tissue infiltration, it can be painful and less convenient. Technical support is required. All right, so this is just a diagram illustrating what we have said. So this, if you are introducing, if you are giving a drug through the mouth, oral inhalers are given through the nose. That's inhalational. Instillation could be through the ears. Intradermal, transdermal parts, sorry. Sublingual, just under the tongue. Subcutaneous, just a little bit below the skin. Intravenous, you're introducing drugs into the vein, venous system. Suppositories or animals through the anus. Intramuscular, you're introducing drug into the muscles. And topical application, which include cream, yes, you're applying the drug directly on the skin. Now, intramuscular routes, advantage of intramuscular absorption is reasonably uniform, reasonably rapid absorption and onset of drug action. First pass effect is avoided. First pass effect is avoided. Mild irritants can be administered. Gastric factors are avoided. Now, disadvantage of intramuscular routes is characterized by local pain, tenderness, abscess may develop if you introduce, infection, local tissue necrosis, infection, nerve, nerve damage is possible because those muscles are innervated by nerves. So there's a possibility of severing a nerve. It's expensive. Only limited volumes can be given. Other parenteral routes of drug administration include subcutaneous route, injection is given just under the skin. Prolonged action is achieved. The absorption is slow. Example of a drug that is administered subcutaneously is insulin. Now, intraarterial routes rarely used except in a few anti-cancer drugs administered for local effect and for drugs used for the diagnosis of peripheral vascular disease. Intra-articular is employed for injection of antibiotics and corticosteroid in inflamed joint cavity. Example of such a condition is rheumatoid arthritis. Transdermal route, drug is given within the layer of the skin. It is sometimes painful. It is painful, right? This route is mainly used for testing the sensitivity to drug and administration of smallpox vaccines. Now, topical route of drug administration. Topical route involves the application of drug directly to the surface of the skin. The eyes, the nose, the ears, the lungs, the vagina, urethra, and as well as the colon. Example of topical dosage forms are solution, suspension, ointment, creams, lotion, gels, sprays, and powder. Now, the advantage of topical routes are there is very low risk of adverse effects, right? It's suitable for local therapeutic effects. There is first pass effect. Disadvantages of topical routes: the drug must be potent, systemic absorption is low. So, thank you for listening. Please like and subscribe and share. Thank you.